Good morning, good afternoon, good evening, and we're joined today not only with you who are here, but also you who are virtually here. So it's really a pleasure to be here with everyone. And my job today is to provide an overview for this session and to talk a little bit about the work that led up to the session, what the topic is about in a little more depth, but mostly to set the stage for what will be almost a day of discussion. And so this high-level piece that I'll be doing is something of a quilt, and the depth of it will be explored, explicated by the panelists. And our panelists are members of the workshop, both the planning committee as well as the actual workshop participants. So you'll be hearing much of what we talked about at the workshop. So in terms of the actual work that has happened, as Susan has said, there is a lot of attention that's been paid to nurses and midwives, nursing and midwifery over the years. But for those of us who've been in the field, I think that we've seen over and over again what sparked this exploration, which is that when a woman becomes a nurse or a midwife, her life is transformed. And not only is her life transformed, but so also is her family's, the community, and the larger society. And this transformation can be small or it can be large, but it includes things like education, an educational transformation, many times the only opportunity for education, a transformation in terms of economic opportunity, and voice. Voice through organizations, voice through collective action. So this is a piece that, this spark, this observation over and over led to the beginning of this exploration in 2012, and I'm noting here that this has been a process of collaboration and partnership throughout the past 2 years. And it really grew with the support of the forum that's supporting this work here. And you heard from Susan, who's chairing that, and our previous chair as well, FF Melise, you'll hear from, I'm sure. And also with the support of the Rockefeller Foundation, the Institute of Medicine, the American Academy of Nursing, the American Nurses Foundation, the American Nurses Association, and very interestingly and positively, the Robert Wood Johnson Foundation, looking at what's happening globally in terms of what can we learn for the U.S. as well as elsewhere. So many thanks are earned throughout this process and deserved. And of course, my home institution, the University of Washington. As Susan mentioned, in September 2014, the Institute of Medicine hosted a workshop. And that workshop was the beginning of this next stage, and this next stage involves you, and today is very much about the way forward. So this is a photo of what you have available out there, which is the pre-release copy of the workshop summary report, and some of the names you'll see there will be speaking today. So this topic, why are we looking at this topic of investment in nursing and midwifery enterprise? Two major aims and a growing third aim. The two most important aims for our discussion so far have been improving women's lives and also strengthening health systems and services. Another aim that has really accrued is to bring returns to those who invest, and returns in a variety of ways, not only financial, but also financial. What's the rationale? Simply that when you invest in women, you invest in the improvement of society as well. Women's well-being benefits more than themselves as well as themselves. And also an investment in health is an investment in society. So that rationale has really moved us forward in thinking about this topic. In terms of the things that bring this topic into sharp focus, some of the forces at work, if you will, at this moment. One is that the governments that we've looked to and are learning about in terms of their challenges of trying to address the health needs of the public is that governments are facing challenges that they can't completely meet. And so the increasing health challenges that they're encountering, whether demographically associated, chronic disease, or in other ways, are causing governments to look beyond their own boundaries of public sector. And as they do that, there are many other partners. So what we're seeing is that governments and other partners are increasingly relying on nurses and midwives in both expanded and new roles as well as traditional roles to provide more affordable and accessible services to rise to those challenges. Along with this, in many ways driving this, is the growing investment of other parties as well as government in innovation. And these innovative approaches have included new forms of enterprise, part of the intersection that you'll be seeing. And then there is this fact, which is that most nurses and midwives are women. It's a natural opportunity. If you want to target a very large group of women, nurses and midwives are a natural opportunity. So the terrain, if you will, what we're crossing in these discussions is pretty broad, and it includes 4 areas, and you could say sectors. And the first is the development sector, and there's a little bit of an irony in all of this, which is the gap that we occupy. And in the development sector, empowerment of women through investment in enterprise is a long-standing practice. It's a practice that's shown great success in many areas, but it's been largely focused on commercial and agricultural ventures. Very little on health. So then if you move to the health sector, its work in empowerment has been predominantly focused on services, delivering services largely in terms of reproductive health, family health, those kinds of services. But seldom has it looked inward into how it can empower those that work within that sector. And that's been a limitation and a blind spot within that sector. Nursing and midwifery has focused on empowerment of women in various ways, including through the services it delivers, its organizations, collective action, volunteerism, and of course the intrinsic career and economic opportunities. But it hasn't thought of itself much in terms of a conscious mode of empowering itself and the women in the profession through enterprise. And then the social finance and enterprise arena, investors are moving rapidly and creatively in the health sector, and enterprise is growing, but explicit aims with respect to empowerment are generally not surfacing. So, at least in the health sector. So that's the terrain, and if you look at this, we did some landscaping work with the Center for Health Market Innovations, and we did extensive review of the literature, and we found that these sectors, there's a tiny point of convergence, and that point is the point of opportunity. If you could bring these together to explicitly invest in nursing and midwifery and in the enterprise that could be developed in that arena, could there be gains with respect to health and with respect to empowerment? And that's the area that we're working in. So lessons so far, very high level and many questions. It's promising for empowerment and health gains, that kind of investment and that kind of enterprise. There are significant opportunities right now in this space with all of the change that's happening and all of the investment that's growing. But there are challenges that are hardwired into many health systems as well as into many societies, and Susan spoke a bit about that. We also learned and are learning that there are lessons that are happening globally, and much is happening in lower income countries that can help us to inform future innovation, the lessons and models that are emerging. And underlying all of this is the need to figure out how the public-private sector partnership can be created, can be fostered, can be underpinned in terms of institutional and societal supports. So the way forward today, this is all about a discussion, and it's aimed at deepening the collective knowledge and insights that we can share among us, but also raising the key questions and putting ideas forward. Because when you have workshops, when you have reports, it's wonderful to inform people, but unless they go somewhere, it's really quite a loss. We're also looking at identifying areas for future work, and I think one of the really exciting things about this group is that you represent that terrain in many different ways. So it's bringing together discipline sectors and interests, and hopefully, ultimately, translating into future innovation. So I have the pleasure of having a panel that has great depth in the areas that I've spoken about in not great depth. And our panelists will be speaking. First, we have the panel And then we have respondents, and our panelists will be speaking for about 8 to 10 minutes apiece, bringing their views and their experiences, and representing those different dimensions of the terrain. Diep Yong will be here with us speaking to the women's empowerment piece, and she'll be followed by Krishna Udaya Kumar, who is going to be talking about the health sector and the enterprise in the health sector, and Beth Bafford will be speaking from a social investment perspective and enterprise perspective. And we have respondents who have great experience on the ground who will be joining us. Amelia Ewu, and she will be speaking from her experience at PEPFAR and in Africa, and Petra Tenhu Bender, who will be joining us virtually, is a midwife and has done much in the global midwifery arena, and Susan Kosman, who is here with us from Aetna and very well grounded in the U.S. and innovation in the U.S. So with that, I'm going to have Diep join me here, and I will sit down and we'll go ahead. Yep. Good morning.